Yes, we are here, MA3 Healthcare Solutions, bringing you some information about how Medicare works. Today we have Albert Smith.
Good
Albert
morning.
Good morning, is one of our associates, one of our partners here in the firm. Another, why don't you tell us a little bit about you?
My name is Albert Smith, and I've been in the Medicare arena for the past 4 or 5 years. And what I've been doing is explaining the different options associated with Medicare. You know, our seniors are turning 65 at a rate of, 10,000 a day. So my job is to explain the confusing path that they have to navigate through.
Another thing I would like you to share with everyone else is that you are a veteran.
Yes, I am. I served in the U.S. military for 2 years. I was in the U.S. in the 82nd Airborne, and the veteran services itself does supply some health care for veterans, but it is not complete. You, as a veteran, you need more.
So that's one of the things I would like to share with everyone, that if you are a VA, you're in the VA benefits, you're a veteran, and you are wondering if a Medicare Advantage or a Medicare supplemental plan would fit you better or will help you, we have an expert. I know VA have different levels of service, so Albert is our expert on those topics. So let's start explaining what's Medicare. So Albert, why don't you start?
Medicare is made of 3 parts. In short, you pay for your Part A through your working life. If you have worked 10 years, or 40 quarters, the premium is free for you. And when you reach 65, you do have an option of applying for a Part B, which I think you should. But it has a premium of $144.60. But one thing you need to understand, Medicare does not cover everything. So you need to talk to one of our agents here in the office and find out what your needs are, what you have today, and what you can get.
And one of the things I would like also to add to this, before we go into detail how every part covers your medical care, is that a lot of people, they're still working, they reach the age of 65 and they decide to keep in their group insurance. When that happens, you can delay your Part B. You can say, well, after crunching some numbers, you decide, well, my group insurance has better options because it has a lower premium, has a lower copayment. They have the doctor's time in. My prescription is really inexpensive. So in that situation, it could be a good idea to delay your Part B. But there are some other situations where you may think, well, now my insurance is getting more expensive. Now I stopped working. My group insurance is no longer, because my company, the hotel I was working with, the restaurant, they just laid off some staff. So what do you think about that, Albert?
You should immediately give us a call, and what we can do is sit down with you and find out what your general options are, because you need to do this approximately 2 to 3 months prior to them letting your coverage expire, because time is of the essence. We need to find out when you're leaving your employer, when your plan ends, and how to cover any gaps that may be there, because you only have a limited time to sign up for a particular plan, or you will be penalized, and what's more important, you will be without coverage.
That's right. So now let's talk about how the Part A works. So let me start with the Part A. And the Part A, all the money that you work for, all those contributions that were made in your behalf towards Medicare, all that money went into the Part A fund. And all that money will help to pay for everything that you can see and touch in a hospitalization. So the bed I'm put on, the X-ray machine, the MRI machine, those items are going to get paid from the Part A. Also, if I need some inpatient mental health, I need skilled nursing facility, hospice, or some blood transfusions, those are getting paid from the Part A. But when I'm using my Part A, I am responsible for some financial items. For example, the deductible. There is a $1,408 deductible per stay. So for that benefit period, if I'm staying 4 days there, I'm released back home, I will receive my bill for $1,408 from the hospital. So right now, we're talking about the hospital only, not doctors, not nurses, not anesthesiologists, just the physical part of the building and everything I can see and touch. If I'm coming back to the hospital, if I need to go back to the hospital and spend another 5 days, for that benefit period, now I accumulate 10 days. If I keep going back and forth within those first 60 days, that will be covered by my deductible. But if I stay longer, if I accumulate more than 60 days, then I will pay $352 co-insurance per day. If I accumulate more than 90 days, then that will be $704 per day. Now, this slide talks about the 40 quarters that you need in order to get your Medicare Part A for free. As well, you already work for it. Now Albert is going to let us know about the Part B.
Part B takes care of your doctors, your nurses, and the general people that are surrounding you while you're in your stay. And they take care of your physician services, outpatient hospital services, your ambulance services, and VA does not provide ambulance service. Just a little added. Outpatient mental health is provided, lab services, durable medical equipment, which is your wheelchairs, oxygen, and all the little maybe appliances that you would possibly need, like your walkers and that kind of thing. Your outpatient physical care, occupational care, and speech language therapy, and some preventive care. Actually, there's quite a few preventive care services that on an annual basis that we need to do. And Part B does cover that. And standard Part B premium amount is $144.60. With that, you pay that $144.60 a month. And with that comes a deductible of $198 that you will have to satisfy prior to getting any coverage. After your coverage starts, you are still subject to more costs. That cost is approximately 20% of whatever Medicare approved amount that your doctor might charge you. That is your out-of-pocket cost. Medicare only pays 80% of your coverage.
Now, Albert, there's sometimes some people telling me, well, I'm really healthy. I don't see the reason why I need to pay $144.60. I never go to the doctor. I don't take any prescription, so I will enroll later on when I need the Part B. What you can tell us about this?
Well, I'd say don't. I say enroll when you're eligible, because if you do not, what will happen is you will get penalized, and that penalty happens to be 10% of that $144.60 for each year that you do not sign up, and it is cumulative over time. So say 5 years from now, you need that to get that coverage. That coverage is going to cost you 10% of $144 will be $14.46 for each one of those years, in addition to that $144 just to initiate it, get it started. So my thing is, get it done now.
And another thing I would like to add here is that if you are diagnosed suddenly with a chronic illness, or you have emergency room, and then they decide, well, you have a heart attack, you have stroke, it will take more time. You won't be eligible. You're going to be signed automatically into Part B. It will take time for the process to go through. So it's nothing like you will enroll today and tomorrow you will have your Part B. It will take time. Sometimes, depending on your person, they may want to verify some of the information you're providing them, and that takes time. And in my case, I have some clients where they start all the procedure, they take all the paperwork, they go. It is 1 month going by, nothing happens, and they go, and turns out the procedure was even started. I don't know if you have any examples like that, Albert.
Yes, I do. But I tell you right now, I've run into clients that we put in paperwork that start their initial coverage, and what has happened is that it'll take a month and a half for things to come back to them. They get the letter, and they find some of the information is incorrect. So now it's going to take another month and a half to correct those things. So we want to get ahead of those things. We want to do it prior to when you actually need that coverage. We want you to be covered. We don't want you hanging out there with nothing.
Exactly.
Especially this time of the year.
When you have a situation like that, when you have a heart attack, when you have diagnosed cancer or another chronic situation, the last thing you're thinking is to deal with this situation. So just be prepared, be ready for this situation. Nowadays, I think what we are living right now, it tells us a little bit about being prepared for emergency situations. I would dare say, Albert.
That's so correct.
Yeah, be prepared, be ready for it. Talk to us. A lot of people they are having they're wondering, well, how am I going to afford my co-payment for the hospitalization? Well, we have some solutions for you. Just give us a call or send us a message, and we're here for you. So now let's talk about the Part D. They have some ground rules from the federal government, from Medicare, and one of those rules is you have to have at least 5 years. Now, keep in mind that in contrast with your regular group insurance, you may find generic prescriptions on tier 1 or tier 2, tier 3, or tier 4. You may find that one company has the brand name prescriptions on tier 2 or tier 1. So every single company, they have a different tier, different prescriptions on those tiers. So it could be that while I'm taking a prescription, an insulin that I'm paying $25, my next door neighbor is taking the same insulin, is taking the same amount, and he's paying $200. The reason is because probably on his company, that insulin is on tier 4. So keep that in mind when you're looking for your Medicare plan, your Medicare option. Tell us, these are the prescriptions I'm taking. I would like to bring this into the equation so you can get the plan that will fit your needs. Also, EMI is going to affect your premiums. So if for some reason I'm making more than $87,000 2 years ago, I will pay an overprice of $1,220 on top of my premium. And that amount is going to be charged through the insurance company. So instead of getting a bill for $15, I'm going to get a bill for $27 and $20 and so on. Anything you like to add, Albert, before we start talking about the 4 stages?
That is it. You just stated that that bill will be added by the insurance company?
Yes.
Or will you get a separate bill from the government?
No, you will get the bill through the private insurance. They are going to collect that money, and they will keep their premium, and the whatever amount is over that corresponds to IRMA is being sent to the Medicare office.
Okay, that's clear.
Now let's talk about the phases of the Part D coverage. Everything starts on January 1st. January 1st, everything starts. Let's pretend I'm taking 2 prescriptions. One
Right.
prescription is $335. The other one is $100. So I'm going to the pharmacy January 1st, go to the counter because my deductible is $435. Then I will pay $435 at the counter. And in Medicare, they have a tab. Well, they have 2 tabs for me. One
Yes.
tab is going to show the real cost of the prescription I'm taking home, and the other one is going to show how much I'm paying at the counter. So in January, the tab that shows how much I've been paying towards out of my pocket in the counter is going to show $435. February arrives. I'm going back to my pharmacy. I'm going back to pick up my prescription. Now I will be on the initial coverage stage. When I'm here, I will pay the copay. Whatever copay my company has for my prescription, I will pay for it. So let's pretend I'm paying $50 for my 335 prescription and $10 for my $100 prescription. So I will be paying $60 at the counter. So that little gnome back in Medicare is going to write down, Armando took home $435 worth of medicine, and he paid $60 on February, on that column that says Armando paid, how much I have been paying for that. When the column that says the real cost of the prescription reaches the amount of $4,020, that little gnome is going to push me into the gap, into the next stage. That is the gap. When I fall into the gap, donut hole, I will pay 25% of the real cost of the prescription, which means I will pay 25% of my $335, and I will pay 25% of my $100 prescription. So how much it will be, Albert? $25 for the 100 and 75. 25% of 35 is what? 7, 8 and cents. So I will be paying something around 80, 82, 83, 84 dollars for that prescription. So I will pay 85 plus the 25. So those numbers are going to go in the column that says Armando paid this much at the counter. When that column, when that tab reads $6,350, then the gnome is going to reach in and get me out to the next stage that is called catastrophic. When I'm there, I will pay either 5% of the real cost of the prescription, or $360 for generics, $895 for brand name prescriptions, whichever is the greater. Anything you like to add, Albert, to this?
You said $895. You say for whichever is greater. Is there any clarification of greater? What do you mean?
Yes. So if, for example, let's go back to my example. I think we have an example here. So in this example, 35% of my prescription is $25 and $83.75.
Right.
So 5% of $83.75 is
$895.
$895.
Yes. The question I'm asking is, okay, you said, or 5%. Is it 5%? We're looking at the one Ocaball. Is 5% of the full cost 25. Of the medication?
Yeah, that will be the full percent of the full cost. So 5%, it will be 5% of 100 will be $5.
Okay.
So because $5 is greater than $360, I will pay $5.
Okay.
In the Viejo Fenol, if it's $335, 5% of it is what?
5% of $330, $15. Yeah. That's $17 total.
Like $17 because it's greater than $8.95. It says $17.
Okay.
Yeah, excellent question. Yeah, and I hope this is clear for everyone. Well, I know it's not that clear because there's a lot of numbers. But keep in mind that some people, they take prescriptions, they are too expensive, they see falling into the gap, themselves fall into the gap around October, September, some people in July. And some people, they have the impression that the insurance company is no longer covering for the prescription. Keep in mind that yes, you're still covered, but no, you are responsible for the bigger part of the bill.
Correct.
Now, there are some companies that they will give you some protection. They will avoid the deductible. They won't let you go into the deductible, or they will give you some little help through the coverage gap. Just I want to tell everyone that there is not a company that will cover all the prescriptions at 100%.
No, there is not. Never.
Some prescriptions they are covered. Some prescriptions they have a low copayment, but most of the prescriptions they have a copayment. So Albert, just to finalize, could you please tell us a little bit about the extra help?
Extra help. Extra help is for individuals who their income falls below a certain level. The government has set up a program they call extra help or low income subsidy. And if you qualify for that, it will pay for some of your co-pays, co-insurance, and it may even pay for the medication.
So there you go. And can you tell us a little bit about the what is the income I need to have in order to qualify for extra help?
It's $17,000 generally for a single individual, and it's approximately $24,000 for a couple. That is generally the guidelines. There is some flexibility, and each year it tends to change. So you should check, give us a call, and we'll give you the exact figure.
Yes, because also keep in mind that if you have adult children living with you, you have people living with you besides your spouse, they will take that into consideration, and you may qualify. Even if you are making more money, you will be able to qualify for that extra help. And if you don't qualify for full percent, if you won't qualify for 100%, you may qualify for 75%, 50%, 15%. But I think any extra help will help in these days, right?
Correct. I actually, when I sit down with individuals, a lot state that their income may be kind of borderline. I tell, irregardless of your situation, just go online. It takes you 10 minutes to apply. Go online, Medicare.gov, and submit your information, and they'll either say yes or no.
Well, I don't know if I think that's it for today. In another session, we will talk about the options that you have with Medicare to help with all the different deductibles and co-insurance we talk about today. We will talk about supplemental plans. We will talk about Medicare Advantage plan. We will talk about which one is best. And let us know.
No best. There's no best.
That was a little surprise for you. There is not a best plan. Is the plan that is best for you. I have some clients where the spouse is in a supplemental plan and the other one is on a Medicare Advantage plan. So really, we have different options. You have a lot of options, and we will help you because we are certified. We're brokers and we're certified with all the companies in the area. We will be able to help you to find the plan that fits your needs. So, Albert, anything you'd like to say just to end this?
At this particular time, I just say thank you. I really do appreciate your time, and stay safe.
Same here. Stay safe, wash your hands, and keep calm. And, we are here to help you. Give us a call, send us a message. We are able to do enrollments over the phone. We are able to do enrollments online. And just stay safe. Thank you.
Take care.